Dear Secondary 2, how are you? I hope you are fine. Today we're talking about the kidney, one of the most excretory organ after the skin. Here is the structure of the kidney. It consists of two parts. The first part is cortex. Here is a dark one, and also it consists of medulla, which takes pyramid shape, and also consists of pelvis or renal pelvis. Of course, we have a renal vein and renal artery. Renal artery into the kidney have oxygenated blood from the aorta, but it contains waste to enter to the kidney to be filtered and reabsorbed again. And the vein comes to the gets out from the kidney to go to the heart through the vein cava. Here is the cortex or renal cortex, and this one is the middle. Each kidney consists of 1 million of nephron, so we have 2 million of nephron tubules in the kidney to do its function. Here we have lower vertebrates and higher vertebrates. Lower vertebrates have a long thin kidney, and higher vertebrates have firm shaped kidney at the both sides of vertebral column and behind them in the abdominal cavity. Here the length of each kidney is about 12 centimeter, and its width is 7 centimeter, and its thickness is about 3 centimeter. Its shape is take pin shape. Of course, it's concave from outside and convex from inside. Okay, let's start with the renal artery, which is a blood supply here. Yeah, it's a blood supply from the renal artery comes from the aorta, and it enters to the two kidneys, and renal vein comes out from the two kidneys to the vena cava. Of course, the kidney adjusts the amount of the water that found inside your body. Here is the structure or description of the kidney. It have concave shape and convex shape. From outer, it have a convex shape, and inner it have concave shape, and inside the concave shape it have pelvis. And this pelvis part it collects the urine inside it to go to the ureter, after that to the urinary bladder. Nephron, one of the important and structure unit of structure and function of the kidney, it play an important role in filtration and reabsorption of the waste. It consists of three parts, which is a Pullman's capsule here, and proximal tubule or first call tubule, and lobophenol, and then collecting duct. Let's start with the functional unit of the kidney, which is called nephron, and it contains 1 million each part. The nephron, first part is the Pullman's capsule found in the cortex. Each nephron consists of glomerulus, which is tuft of the blood capillaries surrounded by Pullman's capsule, and this Pullman's capsule, the second part, which is dilated blind beginning of the nephron, and this capsule is cup shaped, okay, and it is swelling, and comes from out it is a nephron tubule that extend to the cortex, then to the middle of the kidney. Proximal convoluted tubule is the first cold tubule that present in the cortex, and also lobophenol, which have a U shape, and it's found in medulla, and it play an important role in filtration. And distal convoluted tubule, with second cold tubule, and they play an important role found in the cortex, and they play an important role for reabsorption. And finally, collecting duct, which open in the pelvis of the kidney, which is a concave cavity of the kidney, to get out of the wastes through the two kidneys. Okay. After that, we have a ureter, which gets out from the pelvis to which pass through it the urine into the urinary bladder through the urethra. Here is the glomerulus tubule, glomerulus filtration, that filter the blood from any wasted excess of food, excess of glucose, excess of water, urea, and enter to the proximal tubule which found in the cortex. Nephric tubule is started with coiled in the cortex, which is the first coiled tubule, and then U-shaped structure in the medulla, then it coiled again second coiled tubule in the cortex. Urine extraction, of course, the two branches of the renal arteries comes from the aorta, play an important role to enter the kidney, and in its concave shape or concave surface. The renal arteries divide into create many similar arterioles to filter the blood and make a filtration of the blood inside the Bowman's capsule through the glomerulus. In Bowman's capsule, the blood fluid or the plasma filters out from any excess water, excess waste, excess glucose, excess salts, and then pass through the nephric tubule, except the blood and protein, as blood and protein have a large size, so not pass through the or not filtered. Inside the nephric tubule, we have another process which is called reabsorption process of the blood plasma, which filtered or returns the what the need by the human from the water or from the excess water or glucose or minerals. Okay. The remaining liquid contains nitrogenous wastes, urea, and inorganic salts, excess salt and substance from the urine, and that's from extraction of the wastes gets out in form of urine. Urine passed through the collecting duct and then collected through the urinary bladder and it passed through the ureters. And this bladder, when it's filled, the muscle relax and get them out. This urine contains nitrogenous wastes, vitamins, and small amount of vitamins and glucose. Kidney failure, of course, may be one of the diseases or that the kidney may be stop its function, and that result of infection of the two kidneys and this disease, and that cause accumulation of the harmful wastes in the blood, then poisoning and death. And this artificial kidney must be done as a treatment for who have any disease in the kidney like kidney failure, as the patient that have this disease will pass through a channeled or device have artery, tube-like artery, and this tube is a semi-permeable membrane to filter excess water and excess salt and excess glucose and excess urine, and it's called dialysis. And this one have a uremia or excess of uric acid or kidney failure. From the other side of the tube, a purified liquid is passed through it, which is called plasma, except it doesn't contain urea, and this excess of urea and harmful wastes will be passed from the blood through the semi-permeable membrane to the purified liquid through the osmosis process from high concentration to low concentration, and the blood returned back to the patient, which is pure blood. And this pure blood returned back to the patient and receives an artificial kidney and use a receive it from his artificial kidney, and that's done every 2 or 3 times per week. Here we have finished the kidney. Study hard and good luck.